Hi, everybody. So I will take a look sort of from a slightly different perspective than other folks are looking at. The conversations have really been around rural and population health, and I'm going to look a little more broadly at the congressional response to COVID-19, sort of with a focus on rural health. So Congress has passed four bills in response to the coronavirus pandemic. The first one was passed on March 6th, and the most recent was passed on April 26th. We really haven't seen significant action since that time. You're hearing voices from the Republican Party in particular who are saying, let's wait and see, as the Democratic Party is pushing for more responses. So we have four bills. We have the Coronavirus Preparedness and Response Supplemental Appropriations Act, the Family First Coronavirus Response Act, the CARES Act, and the Paycheck Protection Program and Healthcare Enhancement Act. So the first one, was really just Congress saying, oh, we have a problem. This pandemic is coming. We clearly see that there are issues. We're going to give, a little extra money to all of the agencies who would handle this issue. So it's a $7.8 billion bill. And I've been in Congress too long when I say $1 billion bill is a little bit of money. But these were for agencies like FDA and CDC, NIH, and HHS and SBA to provide funding to help address problems with the epidemic, including health problems and economic issues. So that was quickly followed up. Congress quickly realized that was insufficient. There was a lot more that needed to be done. The economic situation was really problematic, and the health situation was fast deteriorating. So we got the Families First Coronavirus Response Act. So that bill provided an additional $3.47 billion in funding. A large portion of that was dedicated to maintaining access to nutrition services like SNAP, WIC, TFAP, et cetera, things like that are very important in urban and rural environments. It also put in $1 billion in the Public Health Social Services Emergency Fund, specifically to help healthcare providers cover the cost of COVID-19 testing for the uninsured. It also provided a temporary increase in the federal match for Medicaid, expanded access to paid sick leave, and required that COVID-19 testing and related services be covered without cost sharing across payers, so Medicare, Medicaid, and private insurance. And that was later expanded upon in the CARES Act as well. So it's been ongoing. The CARES Act, I'll focus a little bit more on this one, sort of touch gently on each of the other three bills, because this was a $2 trillion bill, which is the largest stimulus in United States history. Really was a substantial effort and demonstrated just how profoundly concerned bipartisan members of Congress were, because we don't see this sort of fast-moving, really large spending package come out of Congress almost ever. There are regular fights around how to spend even the smallest dollar. And in this case, we're just putting trillions of dollars into the economy. So it demonstrated how important things were. This is a bill that sort of touched on every part of our economy, and every part of our healthcare industry. So I'm not going to go into every single provision, but a couple of the top line pieces. So really, the big headliners were focused on the economic side of things, and with some on the health. So we saw expanded unemployment insurance with a 600-week increase per week increase in benefits. This expires at the end of July, and is a very serious part of the conversations around sort of the next package and what that should look like as economic conditions change but don't dramatically improve. They also created the Paycheck Protection Program through the Small Business Administration. So this provided loans to small businesses under 500 employees, including rural health providers. It was a $350 billion program to begin with. And initially there were some hiccups around implementation. I think anytime a big bureaucracy is asked to push a lot of money out the door very quickly, there are challenges. And we saw, particularly rural health providers and, small mom and pop shops and minority owned businesses really struggle to get that first tranche of funding through this program. Over time, Treasury, SBA, and Congress have taken steps to address that. They've made changes to make it easier for rural providers and other folks to access those loans. They've also plussed up the funding, as we'll see in the next bill. We also saw a $1,200 recovery rebate for each American under a certain income cap, $150 billion for state and local governments, and $500 billion for mid and large-sized businesses. So that pot of money was largely handled by the Federal Reserve. So looking specifically at rural healthcare providers, the CARES Act included a lot of, as you would imagine, given that it's responding to a pandemic, a lot of provisions related to healthcare. So we had that $100 billion fund for hospitals, physician practices, and other healthcare providers. This was for rural providers. What we were hearing was largely, concerns about lost revenue due to canceling elective procedures, but for a number of providers, it was also PPE, testing supplies, emergency operations, et cetera. So sort of like the PPP, we had a little bit of a few hiccups early on. And HHS, was trying to find that balance for how to get large amounts of money out the door, quickly, while also sending it to the right people. So they initially sent it out the door going to, based on Medicare payments in the past. That worked for some providers, but was problematic for folks that traditionally relied on Medicaid payments more, or children's hospitals, that sort of thing. So over time, as HHS was sort of working through these hiccups, they realized that they needed to set aside money for particular populations that weren't necessarily being captured in those larger pots. And so we saw HHS set aside $10 billion specifically for rural providers. Other provisions, I think the Medicare sequester was touched on briefly, so that's suspended through the end of the year. There's a 20% Medicare add-on payment for treating COVID-19 patients, an expansion of the Medicare Accelerated Payments Program. So this program provides loans for providers upfront based on what their future Medicare payments are expected to be. And we're seeing a lot of conversation around this now. So it went out pretty smoothly. HHS had to suspend the program because of the impact on the Medicare Trust Fund. And now we're seeing conversations from rural providers, from hospitals, for providers across the board saying, we're still struggling financially. We can't necessarily repay these loans under these circumstances. So there are a lot of bipartisan conversations on Capitol Hill about how to adjust the repayment for those loans, whether we lower the interest rates or change the payment schedule or forgive the loans entirely. The major challenge for doing that, there is bipartisan support, lots of concern around it. The major challenge will be paying for it because, as I mentioned, the Medicare Trust Fund insolvency situation is not in great shape. So we also saw, some funding for community health centers, as well as $180 million in HRSA grant programs, specifically for strengthening telehealth and rural community health. We also saw a number of other health provisions in the CARES Act. So we saw the reauthorization of the health extenders through November 30th, 2020. For those who track Congress and all of this, you'll know the health extenders is this regular big package of different programs like the community health centers, the National Health Service Corps, the Teaching Health Centers program with GME programs. It's a long list. I highlighted a few of them in the slides. And this is a regular fight. The fight isn't over the programs themselves. There's broad bipartisan support for pretty much all of them. The fight is always over how to pay for them. And so they were supposed to expire in May, which, as you can imagine, having the community health centers expire in May, right, would have been a substantial problem during a pandemic. So they pushed that into the lame duck, and they'll deal with it later. We also saw immunity from certain malpractice lawsuits, and then issues to address the workforce. So reassigning National Health Service Corps providers and establishing a ready reserve corps of trained doctors. So making sure that we have folks in the right places to treat people when we need them. And then, one of the things that the CARES Act, it started with the initial appropriations bills, but over time, Congress has taken steps to dramatically increase access to telehealth. And Congress sort of made a number of steps, but the administration's really run away with it. So we have seen flexibilities and regulatory changes that have made access to telehealth widespread in a way that just was not the case 6 months ago. So specifically in the CARES Act, we had FQHCs and rural health clinics able to provide telehealth services to Medicare patients in their homes, opening the door to phone-based services. We saw HRSA grant programs for telehealth, specifically to help providers set up, get technical assistance, have the tools that they need to provide telehealth. And then we saw funding for broadband investment, about $125 million. So the trick with broadband investment is the gap is in the billions, not the millions. But it was, a step recognizing that, particularly for rural communities, if you want to provide telehealth, you have to have access to high-speed internet. Opening the door to phone-based services as opposed to video-based services is a step in that direction. Allowing folks who don't have high-speed internet, don't have broadband, to use telehealth, but that broadband connection is really important. As I said, the administration went even further and pushed reimbursement parity and really increased the number of people who could be eligible for various types of telehealth programs. So we've seen that increase, and I think there's broad bipartisan support for continuing that regulatory relax going forward. So I think that would be a particular benefit for rural health communities that are looking at access issues. And then the final bill that Congress passed on April 26th, it's late April, it is really a sign of how bad things were, that when Congress looked back just a few weeks after passing a $2 trillion bill, they said, that's not enough. We need more. And we need to fix some of the technical problems in the bill. So, shortly after passing CARES, they provided another almost $500 million, or $500 billion, almost $500 billion in additional funding. And a significant portion of that, $321 billion, was for the Paycheck Protection Program, which, as I said before, rural providers under 500 could benefit from, as well as another $75 billion for hospitals and healthcare providers, because it became very clear that that first pot of money was not going to be sufficient to meet the revenue and cost challenges that rural and other providers were facing due to COVID. Then we also saw money for the disaster loans program and $25 billion for testing, which included $825 million for community health centers and rural health clinics. And so I'll wrap up by just saying, what comes next? That's sort of anyone's question. If you'd asked me 2 weeks ago, I would have said, well, when the next bill comes. But things change quickly on Capitol Hill, and we've seen particularly given the most recent job numbers, we've seen a lot of reluctance on the Republican side in particular to move forward with another package. If we do move something, if something goes, on the Republican side, they're really looking to include a few particular things. One is liability protections for businesses, including hospitals and health providers. This is a must-have on the Republican side. So we don't know exactly what they're looking at yet. The sort of speculation is something around a safe harbor for folks following CDC or local guidelines. But they will insist on having those protections in another bill. They're also looking at incentives to encourage a safe reopening rather than continued reliance on federal stimulus. And then support for rural hospitals is something that comes up repeatedly when I talk to folks on the Hill. There's still a lot of concern about the financial state of a number of hospitals that are, especially as we're seeing cases of COVID-19 rise in rural communities. And then on the Democratic side, they passed a $3 trillion package. I don't even remember when now, time is an illusion. I believe it was in May. And that package, really just held every single Democratic priority, anything that you could possibly want, sort of like CARES, it touched on everything. But looking forward to a package, that bill is dead on arrival in the U.S. Senate. So, looking forward to what the Democrats will be negotiating in a future package is funding for state and local governments, including an FMAP increase, additional provider relief, including for rural providers, national plans for testing and contact tracing and future vaccine distribution, increase access to insurance coverage. So in the HEROES Act, we saw a new special enrollment period for the ACA, as well as coverage of COBRA for folks who lost their job. And then we support for essential workers, including healthcare providers. There's a whole provision about providing hazard pay to folks who are working during the pandemic. And then we've really seen, so this was sort of always a part of the conversation, was the racial and ethnic health disparities, but really over the past past month or so, as we've seen such unrest in the country, this has become even more important and more at the forefront of what folks are looking at. So, short answer is that those bipartisan conversations have to happen and haven't happened yet. But, we will be keeping an eye on them. And so that's it. But Karen, I'm going to turn it over to you now.